Welcome to Module 6, the final module in this series on the public health implications of ticks and tick-borne diseases. In this module, we will learn about the public health significance of ticks and tick-borne diseases. Tick-borne diseases affect humans, domestic animals, companion animals, and wild animals. They are responsible for over 95% of vector-borne diseases, and there are an estimated 300,000 cases or more of Lyme disease diagnosed annually in the U.S. Tick-borne disease impacts physical, mental, and long-term health of both humans and animals. They have a significant economic impact, and approximately $500 million are spent annually in the U.S. on just tick-borne disease alone. Lack of sufficient knowledge about tick-borne illnesses, challenges associated with counseling, diagnosing, and treating these diseases continues to plague healthcare providers in the U.S., as well as their patients. There are 4 major ticks of concern in the U.S., or 4 major genuses, I should say. The Ixodes genus can transmit Anaplasma, Borrelia burgdorferi, and Miyamotoi, which are Lyme disease, Ehrlichia, Babesia, Powassan virus, tularemia, and Bartonella. Amblyoma species are responsible for different rickettsial diseases, Ehrlichia, viruses, and the now infamous alpha-gal allergy to mammalian meat consumption. Dermacentor species transmit Colorado tick fever, rickettsial species, tularemia, Babesia. And Rhipicephalus species, the brown dog tick, are responsible for transmitting rickettsial diseases, Babesia in dogs, as well as Bartonella. In order to tackle the tick-borne disease problem in the U.S., we need to address the gaps in knowledge. There is a need for greater training materials, developing resources and tools, workshops, and educational content. There needs to be education of community partners, including educating extension professionals, community liaisons, and public health professionals. We need to create awareness among physicians and healthcare professionals about tick-borne diseases in their practice area. And we need to educate the public about specific demographics that are at risk for tick-borne diseases. And we can use training materials, workshops, engagement researchers, as well as community partners. In order to address gaps in disease surveillance, there are numerous things that we can do, but large ones incorporate collaboration and building One Health partnerships to prevent tick-borne diseases. These are dealing with the environmental health, the human health, and the animal health in a society. We need to be conducting research on existing and emerging tick-borne diseases and disseminate those findings widely. We need to establish systems for global data sharing and notification of diseases. And we need to develop local, state, national, and global disease surveillance systems for tick-borne diseases. In summary, ticks and tick-borne diseases pose negative impacts on the health and wellness of animals and humans and cause economic burden to the society. It is essential to close gaps in knowledge and awareness regarding tick-borne diseases amongst healthcare practitioners, public health officials, and extension professionals, researchers, and the community in general. It is also important to establish and set up effective and continuous disease monitoring networks, data sharing, and dissemination of findings to the community. All of this will lead to better awareness about tick-borne diseases in endemic and non-endemic counties, quicker reaction of people so that they can seek treatment, improved tools for diagnosis and treatment, and the development of prevention measures against all of these diseases.